Hello everyone, let's try to solve this question together. So an infant is 37 weeks post-menstrual age now and he remains intubated. He's on 30% oxygen. He's labeled as having grade 3 bronchopulmonary dysplasia. The peak inspiratory pressure is 34 and the peak end expiratory pressure is 7. The inspiratory time is 0.5 second and the rate is 40. The on-call team decreased the rate to 20 and increased the I time to 1 second. What will happen to the IE ratio? What do you guys think the correct choice? Let me give you the answer first and then we can discuss the question in detail. So the answer is there will be no change in IE ratio. So why is that? If you guys can remember that, the 1 minute cycle has 60 seconds. So here in the first scenario, the rate is 40. So you divide that. So the total cycle is 1.5 second. And of course here the I time is 0.5. So you subtract the 0.5 from 1.5. So 1 second is remaining. That is your expiratory time. So the ratio is 0.5 over 1.5 is 1.2. So what about in the second scenario? So the on-call team decrease the rate and increase the I time to 1 second. Same here, that your cycle 60 divided by 20. So your cycle is 3 seconds. So out of 3 seconds, the infant's I time is 1. So basically 2 seconds are remaining in the expiration. So the ratio is 1:2. So see, in both scenarios, the ratio has not changed. Now, what are the other teaching points here? The one teaching point which I want to stress on is using the word post-menstrual age. I have seen many of the providers using the word corrected gestational age for 37 weeks. That's not the right thing to do. Suppose this baby is born at 27 weeks gestational age and now 10 weeks old, and you use a corrected age of 37. That's wrong. Patient is not corrected yet, and I will show you in the following slides that why we have to use PMA. You can use chronological age, you can use gestational age and PMA, but don't use the word corrected age. See, chronological age is fine if you're using that abbreviation. The other teaching point is about grades of BPD. As you guys remember that BPD, the definition has been changing, and from mild, moderate, severe, now people are using grades, and I will show you the slides on that. The other thing is, the definition of course depends upon as why it's labeled as grade 3, because the patient is on invasive ventilation. When patient is on invasive, so easy way to remember, the higher the support, the higher the grade. The lower the support of respiratory support, the lower the grade. Easy to remember. And of course, you have to still use the 36 weeks cutoff time to define the BPD. So now let's go and discuss about what we talk about that using. So see, here is the thing. The corrected age starts after the expected date of delivery. So if patient is born at 27 and now 37 weeks, you should not use the word corrected age. I hope I am making this point clear. This presentation is available. It's a short video, like 1 minute and 29 seconds. You guys can watch that. That explains about the differences between using different terminologies. So look at that. Now, what about, like I said, see that this is the older definition where we used to call mild, moderate, and severe. And again, you don't have to remember that because this definition has changed now. So now you have to remember the simplified version, which is very easy. No BPD if no support. If the baby is on nasal flow of less than 2 liters, that's grade B. If more than 2 liter all nasal CPAP, that is grade 2. And if the patient is on invasive mechanical ventilation, either nasally or intubation, that is grade 3, like we saw in the case. So I hope you guys have learned something together today, and please do like and subscribe to our channel, and you guys have a wonderful day. Bye.